The best way to prevent illness is to avoid being exposed to the virus. Coming up on Polk Place, we're going to learn how COVID-19 spreads and how to practice the actions that help prevent the spread of this illness within Florida. Department of Health of Polk County is going to talk about it. Make sure you stick around. Welcome to Polk Place. I'm Brian Lacey, and joining me in studio is Dr. Joy Jackson. She's the director of the Florida Department of Health in Polk County. As we were talking off camera, you're a very popular lady.
It has been rather busy lately, that's for sure.
Tell me a little bit about where we've been, where we are, and where we're going.
At the time of this taping, Polk County has had about 3,800 confirmed cases of COVID-19. And of those 3,800, 40% of the cases have been recognized in the past week alone. So we've had a significant uptick in COVID-19 across the county since mid-June, but the past week has been alarming. So I'm sitting here relaying this information, relaying that we're seeing a bit of a change in demographic of our folks that are diagnosed with COVID, and that we're seeing a younger age group. We're seeing folks in their 20s, 30s, and 40s, where a couple months ago we were seeing more people diagnosed in an older age demographic. So I am concerned, and I believe this is likely related to increased activity. People are sort of tired of dealing with COVID. People need to get back to work, and I fully understand that. The economics of this, the social isolation, the stress has been tremendous. But what we're seeing is that we are seeing more cases in the workplace. We're seeing more cases related to family gatherings and social events. So what I would like to speak with the public about are some actions that we should all take to help prevent further spread of this infection.
As we look at the numbers where we are, how do we stack up in percentages against the larger counties, larger populations in Florida, and smaller populations?
At this time, Polk is ranked 10th in the number of cases within a county. Which pretty much mirrors our percent of population for Florida. But we're sandwiched between two counties that have had a significantly larger number than we have. So I would say that we are probably per population equally impacted as other counties with a large population. And we're seeing diagnosis occurring in people across this county. Our numbers are greater in the municipalities or the zip codes associated with our greater populations of Lakeland and Winter Haven and Haines City, Davenport area, but we're definitely seeing cases across the county, so no place is being spared. We need to all be performing the steps that we should all take to help reduce the spread.
Let's talk about those steps. When it just seems like no matter from March till now, it's been mask, no mask, mask, no mask, back to mask. Let's talk about that first and foremost. In your professional opinion, if you had to look at each one of the residents in this county and tell them one thing, what would that be?
I think probably, as you said, the most important thing we can all do is wear a mask when we are in public, or even if you are in your house or in an indoor site where you cannot assure social distancing. We've all seen on the news where there have been family gatherings where 15, 18 people that have attended a birthday party have turned positive. The key message here is not everybody with COVID feels sick, and not everybody with COVID looks sick. So we need to treat our people that we encounter, that we don't live with, perhaps like they've been exposed. and we need to keep our social distance, and we absolutely should be wearing masks. That is undoubtedly the most important thing we can do is to wear a mask when we are in public.
One of the stories I heard it from you and a couple of people that we work with here in the office, if you have somebody elderly that lives with you or somebody young that's susceptible to this, talk about the precautions that you should be taking to not spread within your house.
Thank you. At this point, with the degree of spread that we've got, individuals above the age of 60 or 65, and there's not a hard line anymore, and those individuals with chronic health conditions like diabetes, heart disease, chronic lung disease, anything that takes you to the doctor regularly, those individuals really should be staying home at this time. People that encounter those individuals need to view their precautions, not only to protect themselves, but importantly to protect the vulnerable population. So as we're seeing a younger population contract the disease, these individuals are less likely to have severe illness, which we're grateful for. They're more likely to be asymptomatic, but there can be transmission of disease from minimally or asymptomatic individuals. So the efforts we take across this county will help to protect the vulnerable population of any age.
When you say asymptomatic, what exactly does that mean?
Some people with COVID, and it's estimated to be 30 to 40%, may not have any idea they've got it. They may be completely asymptomatic, or the most common thing I hear is, I thought it was just allergies. A little bit of a sniffle, a little bit of a cough. They may or may not have a temperature elevation. They may or may not have muscle aches and things that we typically associate with a fulminant case of COVID. So the symptoms can be very minor or even non-existent.
Let's talk about those symptoms in the event. What are some of the things that folks should look for? And then we'll talk testing, but go ahead and run me through the symptoms that they should be aware of.
From the beginning of this, we were sort of taught and learned that the typical symptoms are temperature elevation and cough, but not everyone has that. Muscle aches, some people will have GI distress, other people will have chest pain, some people will importantly and interestingly lose sense of taste and smell. So everybody with COVID sort of writes their own book on their own symptoms, and as time goes on, we're learning more and more about acute symptoms and potentially long-term consequences of COVID.
What are some of the long-term consequences of COVID?
Well, and all I'm seeing at this point are things that I'm reading about as individual cases. There's been some. I am almost hesitant to describe that because I don't want people to attribute long-term symptoms to COVID, but this is something that a lot of research is being done on.
Talk about the importance of getting tested, because I've seen instances where people just waited, and by the time that they got tested, it was too late.
Well, 2 to 3 months ago, we were in a situation where there was not enough availability of COVID testing. It was test kits, it was not enough labs that had capacity, it was long turnaround times. So I think we've seen a transition where testing is more readily available, but we could quickly inundate the system if everybody goes to get tested without symptoms. So we still advise at this time that those individuals who are symptomatic, potentially exposed to somebody with COVID, or in healthcare providers and first responders are the ones that are highest priority for being tested. And as supplies exist and last, those who are asymptomatic but again have concern, or perhaps their testing site or their work site is requiring it, as there is availability, I think that those folks could consider being tested. So we are seeing across the county more access to testing as community partners increase their testing capacity, and as the CARES Act funding that the county was able to receive, and that leads to expanded testing That's still being planned, and I think will be able to be stood up in the very near future. And we're looking for a way of communicating with the public where there are testing opportunities. Anyone who is sick should contact their healthcare provider to determine if they should be tested and where that testing can occur. So what I'm really talking about is, are there mass testing or mass screening opportunities? And that is still in the works. There are a few in the county, but I anticipate there will be more as we implement the CARES Act funding to expand testing.
Dr. Jackson, we have just a few minutes left. I'd like you to take this final time and reiterate the importance of masks, of washing your hands, doing all the things that it takes to combat this virus.
Right. The message is almost so simple that people have gotten bored of it, and I do admit that. But the message and the actions we should take is constant and consistent. We need to, number one, stay home if you're sick or if you've been contacted that you've got COVID. If you've been exposed to somebody with COVID, likewise stay home. And you will get guidance from your healthcare provider or the health department regarding that. Avoid crowds and mass gatherings. If you're in a small group, if you have not been around those people because you live with them, still wear your mask. If you go out into public, please wear a mask. I wore mine in today, and I will put it on the second this interview is over. We need to wash our hands regularly and avoid touching our nose, eyes, and mouth with unwashed hands. We need to clean our commonly touched surfaces, either in the work site or at home. And we need to be vigilant. We will be living with this for a while. We're in hopes that there will be a vaccine. But if there is not a vaccine for a while, this is not going to go away overnight. So we need to keep our vigilance up. And I appreciate I appreciate what everyone is doing to help reduce the transmission in Polk, which I am definitely concerned about.
Dr. Jackson, I want to thank you for coming in today and look forward to updates within the future.
Thank you very much.
The Florida Department of Health in Polk County wants you to know that the elderly and those with underlying medical problems like high blood pressure, heart problems, and diabetes are more likely to develop serious illness. Here's what you can do right now to protect you and others. Wash your hands often with soap and water, 20 seconds or longer, or use alcohol-based hand sanitizer with at least 60% alcohol. Practice social distancing. Keep 6 feet between you when possible. Avoid hugs, handshakes, large gatherings, and close quarters. Wear a face mask. Cover your mouth and nose with a cloth face cover when around others and out in public, such as the grocery store. Get tested. If you're concerned about your status, get tested for COVID-19 at a testing site near you. Now, if you need more information, you can give the Florida Department of Health in Polk County a call at 863-519-7900 or look them up on the web at www.polk.floridahealth.gov.